I'm Ian Gonsenhauser, Chief Quality and Patient Safety Officer at The Ohio State University Wexner Medical Center. Today, I'm joined by my friend and colleague, Dr. Darrell Gray, Chair of our Health Equity Steering Committee. Over the past 6 months, there's mounting data that has shown us exactly how the Black community and minority communities at large have borne the brunt of coronavirus and have suffered disproportionately negative outcomes. Dr. Gray?
We know that as we examine the data and have seen that people of color, African Americans in particular, who have been disproportionately impacted by COVID-19, whether we look at cases, hospitalizations, or death, is largely a symptom of the underlying issues. And some of the data has attributed this to chronic conditions that predispose people of color to poor outcomes, things like cancer, diabetes, cardiovascular disease, stroke prevalence in the communities. But we have to look a little bit higher. And we look at things such as what are called the social determinants of health, the conditions in which people work, live, play, pray, and the larger social structures that shape those things. So if we think about food insecurity, we think about unsafe and overcrowded housing, we think about exposure to toxins, those things that can lead to those chronic conditions that again subsequently lead to poor outcomes from COVID-19. But we have to take a step back even further and look at things like poverty, discrimination, and even racism. Now, as you know, racism is a public health crisis. This was something that's been declared by Franklin County Public Health, the City of Columbus, our president of The Ohio State University, as well as our chancellor. And so if we are to address COVID-19, the disparities therein, we certainly have to address the underlying discrimination and racism therein. The good news is that there are things that are happening right here in Columbus, right here at The Ohio State University, to make progress in this way. Certainly, we've had some successes with the work of the Health Equity Steering Committee, partnering with our Department of Family Medicine and other community-based organizations to distribute community care kits. A couple of weeks ago, we distributed over 11,000 kits, 46,000 masks, because we know that people need assistance to get back on their feet and back into the workplace. Why is that important? We know that disproportionately, most of the essential workers who are going into the workforce or stepping back into the workforce are those of people of color. And so we want to provide assistance to those communities. But we also have to do even better to addressing those issues of food insecurity, of unsafe and overcrowded housing. And I'm excited that The Ohio State University Wexner Medical Center is part of the solution in addressing the underlying social determinants of health.